kicking off the healthcare panel right now. I'll be the moderator. I'll introduce myself first. My name is Ahmed Aisola. I'm a managing director at Guangzhou Healthcare Investments. We're a Chicago-based digital health-focused venture fund. We're actually based out of Elgin. We've been around for about 5 years, and we've made almost 30 investments in early-stage digital health. I can talk a little bit more about our group first, but I'd like to have our panel introduce themselves briefly here, and then what we'll do is we'll go into, after the introductions, have each of our panelists talk about what they've been working on this year, what they've been focusing on this year specifically, and that kind of loops in with Mark's question of what excites you. So we'll start off with Julie.
Can you hear me okay? Yes. So my name is Julia Montrenity. And I wanted to start by saying a big thank you to the shout out of Rich Fogle earlier, who talked about investing in immigrant and women-led firms in the healthcare deal. And I would say it's thanks to people like Rich that people like me get an opportunity. So a huge thanks. And if any family office is looking for talented asset allocators to partner with, please go talk to Rich Fogle. My background, I have spent the last 15 years investing in healthcare. The bulk of my career is actually in private equity, where I have invested over $1 billion of capital. I was co-head for direct private equity investments in healthcare at a pension firm called CDPQ, Caisse de dépôt et placement Québec, covering the United States of America. What led me to doing healthcare tech? Actually, an observation that while we were investing in very large bellwether companies of the US healthcare industry, very often when we were looking to deploy software to either reach to our patients or automate parts of our business, we were partnering with category leaders that had, however, difficulties raising capital from traditional Silicon Valley VC funds. Healthcare is a $3 trillion industry that scares many people. It's very complex, and it takes a certain type of knowledge to understand how to navigate it effectively. And there was an opportunity to support niche and category leaders that do extremely well, do well for not just our returns, but also do well for healthcare by improving patient outcomes, decreasing costs, and expanding access. And that's what led me, as well as 2 other operating partners, to start Base Healthcare Capital. We are based in Chicago, because we love it, but also because this is the hotbed of the healthcare industry in the US. This is where the industry is. And so for startups to look for clients, they should be based here, not in San Francisco. There isn't just much to sell to in San Francisco. So this is how we make it happen. We have a national reach, and we've done investments outside of the Midwest. That's really our hardest to move things here. We've done 2 investments this year and are about to close a 3rd one, and hopefully it's just the beginning. Thank you.
Thank you, everybody. My name is Roger Liu. I'm with Impact Engine, women majority owned impact firm based in Chicago. We invest in both early stage venture as well as later stage growth companies and funds as well. Our impact areas are economic opportunity, environmental sustainability, and health equity. And so the health equity component is primarily around closing kind of access gaps. And for me, my personal background is actually, I come from an operator background. I was a startup guy for a long time, was the CTO of Orbis for about 7 years, and got into impact investing primarily because it just seemed too good to be true, that you could make money and do good at the same time. And so we've been at it for about, I've been at it for 4 years. My primary function at Impact Engine is to support our companies after we invest and help them scale and grow. Thank you.
Good afternoon, everyone. I don't know if the microphone is up, but I'm going to be on. Okay. My name is Star Cunningham. I am the founder and CEO of 4D Healthware. We are an artificially intelligent chronic disease management company based here in Chicago. We do what I like to call telehealth 2.0. It's great for you to have a call with your doctor via telehealth, but it is greater when the doctor can actually see live data coming across the platform that he can use to manage you with. Like I said, I'm based on Chicago. My background, well, it's healthcare now because I've owned this company for about 10 years. But my background is artificial intelligence, machine learning from IBM Smarter Planet. I actually worked on Watson before Watson had the name. And as somebody mentioned, healthcare is very complex. And it's individuals, I believe, that come from outside of healthcare with a view that is extremely different that are inside of healthcare that are allowed to build companies that are able to service a population that we saw as, of course, the most disadvantaged, especially highlighting during the pandemic. So we are here, we are serving patients. I'm excited to be on the panel. Thank you so much, Mark, for having me, and I'm ready to get started.
Thank you, sir. So the next
Welcome
question.
to Zoom. Enter your meeting ID followed by pound.
You're leaving a message.
I didn't mean to do all that.
So the next question is going to be, if we have two investors on the panel, we have an entrepreneur, so it's great to have a mix of panelists here. The next question is, where have you been spending most of your time in healthcare in 2021? What excites you the most?
Such a wide question and so many answers. I probably changed my mind 3 times on my way to the conference, but what I wanted to talk about. And I eventually settled on women tech. Actually. It's an area, so women tech in general is picking up, but healthcare tech is taking a particular angle. If you think about women as half of the population, and women actually control 70% of the household budget. So it's massive purchasing power, and yet in women's health in general, not just in technology, but in general, it's what's called an overlooked category. Half of the population. You take in pharma, can somebody say what's the largest pharmaceutical company for the women category? Well, it's Johnson & Johnson. So it sticks to some of the dichotomy we see here. And why? It has cultural factors attached to it. And I can say this if my accent hasn't betrayed me by now, most probably friends. There are cultural aspects here that actually create stigma around certain women's health and diseases or conditions, around infertility, around menopause, around maternal health. And so it's hard for women to speak up, and therefore there's a perceived lack of market. But with technology, actually, now we get the chance to really move the needle and not only create opportunities, but also access for women to take ownership of their own health and get treatment. We did an investment this summer, and I use it as an example in the field of menopause. So menopause is considered as a wellness issue and not a medical problem. And so when many women go through menopause, they go to the doctor, and the doctor says, sorry, it cannot last. Well, actually, there are tons of evidence-based solutions to help women go through that change and that cycle. And as I said during the diligence, well, pharma doesn't care about it because women don't die from menopause, to which my investor said, wait until you get there and we will see how you deal with it. And so there are treatments, hormonal replacement therapy, there are evidence-based solutions, there are lifestyle changes to do, probiotic, vitamins, etc., that can really help women go through this phase of their life. And by the way, menopause is unfortunately racist and cuts across skin lines. It's known that menopause is longer and has more acute symptoms for women of color. So if we can actually deliver an offering to the market, we can also support many women along those lines. We supported a business called Follow Health. It was founded by 3 wonderful women. The former editor-in-chief of Marie Claire, who knows how to speak to that age range, a serial entrepreneur called Monica Molina, and Dr. Sharon Malone that had a podcast on menopause with Michelle Obama about a year ago. And together they're moving to not only provide solutions, but also change the narrative. Once the website is out, you will wish you were having menopause. It's a community thing. And that's what excites me about eShield, is we now get to use technology here in the form of telemedicine, access, prescriptions delivered at home to actually shift the narrative across the society. So that's one area I'm really excited about, and that's a vertical we've been spending time on.
So as I mentioned before, health equity is one of our big areas. I think top of the list for us is the affordability of healthcare, and that's both from a consumer perspective as well as an institutional perspective. On the consumer side, 43% of adult Americans are underinsured today, and that's after Obamacare. And I think close to 10% of American adults do not have health insurance. And so that still continues to be a problem. We still see people falling into debt, going into bankruptcy. It's still a pretty common occurrence in the US, and we've been looking at solutions that help a lot of employer-supported ones that help fund as options to essentially give people capital as emergency loans, which is very unfortunate. On the institutional side, there's this kind of disconnect between like who pays and who benefits. I think we see a lot of solutions that actually would save the healthcare industry a lot of money, but hospitals have no incentive to actually buy these things that would actually save money, because at the end of the day, they only get paid for specific procedures. And so we're looking for solutions that help kind of bridge that gap, or innovative funding models that incent essentially the payers to actually subsidize some of these things as they roll out into the healthcare field.
So 3 years ago, who would have thunk that we'd be sitting where we are today? Show of hands, how many people in this room have a smartphone? And that is where most of healthcare technology begins. But you have an entire population of people in this country that do not have smartphones. They don't even have Wi-Fi. They don't even have access to Wi-Fi. So how do you begin to conduct a telehealth or telemedicine call when there is no Wi-Fi, there is no tablet, and there is no smartphone? That means that you have to have companies and individuals who are very intentional about starting at a place where we all are not. And in order to have people who are willing to start there, you have to have people who look like the people who are in those places that do not have access. Because that's when you begin to think about how to start before the smartphone begins. So we spent the most of our time prior to the pandemic building relationships with telecommunication companies that were willing to go the last mile, that were willing to ensure that that patient, when you arrived at their home to deliver care, had access to Wi-Fi. And then we spent the rest of that time partnering with organizations that were willing to ensure that those same individuals had access to smartphones and tablets. I also had to work with companies that were willing to ensure that these patients had medical devices at home. A lot of powerful things have been said on this panel in terms of the complexity of healthcare, the cost of healthcare, and the lack of access to healthcare. And I believe it's even been mentioned on this panel about health disparities. And prior to this panel, it was mentioned that we are a community. So we can no longer afford to not pay attention to individuals who do not have access to care. And when I say we can't afford to, I don't necessarily mean from a financial place. It's true. We can't afford to continue to think that way from a financial perspective, but we also can't afford to think that way from a human perspective. The pandemic shed light on something that we have all known has existed for a long time. It just kind of shoved it in our faces. So now being very real and very intentional about allocating dollars to individuals that are addressing those issues is extremely important. And companies who are addressing those issues in a way that really threads the needle. It's a thread and a needle. Everybody on this panel can talk about individuals who are extremely sick, extremely poor, who are in communities that don't have access. Guess what? When problems are solved for them, they're automatically solved for everyone in this room. I'm going to say that one more time because I want to make sure you get the point. When we solve problems for the poorest and sickest members of our society, everyone who raised their hand with a smartphone, your problems automatically get solved. My problems automatically get solved because now there is access. There is proper care prior to someone needing emergent care. So I spent the majority of my time in the hotspots, in the Delta, and in the rural areas. And, maybe surprisingly to some people, but not to others, right here in urban Chicago. Because when Starbucks and McDonald's and libraries, when places that have public Wi-Fi access close, my patients right here in the urban area of Chicago had challenges and difficulties. So don't think of this as just being a rural problem. This is a nationwide issue. And spending time with the people, with the problems, and with the companies solving those problems is something that is paramount to all of us.
Quick follow-up question on your experiences this year. Did you find that COVID accelerated your conversation with potential customers, or did it actually slow them down? And I've heard mixed reviews from other entrepreneurs.
Yes, that's a great question. So unfortunately, if there is something that we can term a silver lining, when you say accelerated to the point where we have more than we can handle, which is a good problem to have. So for my business, being intelligent telehealth, the pandemic actually has accelerated the conversations, accelerated the access to capital, and fortunately for my patients, accelerated their ability to access care.
Thanks for that. I think it wants me to be the better cop. So again, we have a breakout room. It'll be designated so we can have more interactive conversation, learn about why we should be excited about menopause with your solutions. It's a community building thing. Great. So let's all have a big menopause. 361.
Come join our 361 Firm community of investors and thought leaders. We have a lot of events created by the community as we collaborate on investments and philanthropic interests. Join us.